Thank you, everyone, for joining us tonight for another edition of Ask the Doc Town Hall. We're excited to be here tonight to talk with you about masks, vaccines, testing. Where is COVID headed next? I'm Dr. Rasheeda Monroe. I'm a pediatrician and medical director at WakeMed. Tonight's discussion, we're going to center it around those lingering questions. The questions you may still have. What are we doing about wearing masks? What's going on with vaccination with kids? What's going on with certain populations? Are people still getting sick? We'll talk about ways to ensure that our most vulnerable community members and family members are protected as we head into the spring and summer, and that we are all protected in case of another possible uptick in COVID cases. We're not telling you what to do or what to think, but we want to listen and answer your questions tonight. Let's take a quick look at the state of affairs. The BA.2 variant, the subvariant of the highly contagious Omicron variant, has already led to a surge of cases and hospitalizations in Europe and around the world, and it's now the dominant version of the coronavirus in the United States and beyond. It makes up 55%, or over half of the new cases. And this is up from 39% from the last week in March. If that trajectory continues, we could see about 40,000 new cases of COVID in the United States by mid-April. That's just around the corner. So we don't know how big this wave could be, but we want to share some tips to keep you prepared. The good news, because there is definitely good news, is that Wake County Public Health, our local community hospitals and community partners have successfully collaborated to achieve an 81% vaccination rate for Wake County's eligible population. That includes people 5 and older, with 78% of those who are over 5 years old receiving 2 doses. But we're still seeing under 50% uptake on booster doses, and we're still seeing a disproportionate number of Black and Hispanic communities being hospitalized and dying from COVID. That's why Wake County continues to have 5 vaccine clinics throughout the county, open 6 days a week, with weekend and evening hours. And we continue to not ask for any insurance. No identification is needed. We continue to have outreach events with partners like Hispanic grocery stores and African American fraternities to host vaccine events. So we have some great panelists joining us tonight, and we have a new and special interactive element. We have a community health worker live from a barber shop called a Main Attraction. They're from El Centro Hispano, and they are joining us. You can hear some live questions from the community. For all of those joining on Facebook and YouTube, drop your questions in the chat and we'll try to get to all of them tonight. I would like to have our panelists introduce themselves. I will first open it up to you, Dr. Nicole Mushonga.
Thank you, Dr. Monroe. Good evening, everybody. I am Dr. Nicole Mushonga, and I am a Wake County Health and Human Services interim medical director over public health and also the epidemiology program director. My work has been centered a lot around the pandemic and the response over the last 2.5 years. But now I think we are looking at sort of a new phase to the response. So very excited tonight to answer your questions and provide some more information on how to best keep you and your family safe and our community safe, and what happens next as we kind of continue down this path.
Thank you so much for being with us here again, Dr. Mushonga. What's the biggest question that you're hearing from? I'm sorry, what's the biggest question, Dr. Mushonga, that you are hearing from friends and family?
The biggest question that I think we're getting from everyone, from the media, from the general public, when will this be over? And that's a very difficult question to answer. I don't think anyone has a very specific date or time. I think we had all wished this was over a long time ago. But there are some key factors, some things that we look for to say that this now becomes more of a normal circulating virus within our community and doesn't cause severe infections and death, which are two of the metrics that we would look at. So really, if we're looking at this virus becoming endemic, or at least leading to sort of a more normal day-to-day life living with COVID, it's when the virus becomes less severe, so less severe cases, and we have less cases within our community, either due to immunization or prior infection, but also we're seeing that there's less impact on our hospital system as well. So really, when we began to see that this virus starts acting very similar to what we would call more of a common cold, then we would begin to say that this is more endemic virus. I think one of the biggest things is that we remind people is that the pandemic is not over. We're just in a new phase.
Thank you so much for that. I'm hearing that question repeatedly also, so thank you for going ahead and answering that. I want to turn it over to El Centro Hispano, who is hosting the live watch party and taking questions at the local barbershop. We've got Allison, Julian, and Sandra there at a main attraction. Allison, show us around. Who's at the barbershop? Can you give us a tour and introduce yourselves?
Yes, so my name is Allison. I've been working for Centro Hispano for about 2 years now as a community health worker. And I'm here with my coworker, Julian Abreu. I'll let him introduce himself.
Hey, how you doing? My name is Julian Abreu. I'm CHW del Centro Hispano. I worked for 2 years and a half.
And our other coworker, she's running a little late. But yeah, we're here at the barbershop. There's some people back here, and then we have some people right here. But yeah, we're live from the barbershop.
Awesome. I love this. I love this new live from the barbershop edition, and I'm excited to hear some of the questions from the community members. So let's go ahead and get started. If you all are watching on Facebook or following us on YouTube, go ahead and drop your questions in the chat, and we will get to them as soon as they come in. We definitely want to make sure that we give everyone the opportunity to get their questions answered and to participate tonight. Allison, if you want to go ahead and seeing if anyone in the barbershop has any questions, and start lining up some questions if there are any. But let's start with what I'm getting asked a lot of as a pediatrician. What's up with pediatric vaccines? What is going on with the vaccines for kids, under 6 years old? Are we close? So Dr. Mushonga, what I understand, and I'll let you kind of add in wherever you see fit, is that we're still looking at the data. We are getting closer. So, Pfizer a couple of months ago kind of delayed their process and said we're looking for more information on the efficacy. So how well it works in children, 6 months to 5 years old. They were studying a 2-dose series that there was no safety concerns in the 2-dose series, but they weren't seeing that good, strong antibody response or the protection, the efficacy that we're looking for. So they continued their trial and added a 3rd dose for that age group. And they're still getting the information now to see if that 3rd dose gives us good efficacy. But we got some new news recently from Moderna, who is looking at their vaccine 2-dose series for children under 6 years old. And their data looks, their efficacy and safety data look promising so far. that it looks similar to what we've seen against the Omicron variant in people 6 and over. What else do we need to know? I mean, I hear maybe sometime in early May or mid-May. What do you know, Dr. Mushonga?
I think you hit it right on, Dr. Monroe. It's one of those things where we have these timelines, and based off of the trials and the data that we have pulled and that we're starting to see, they try to make estimates on when the vaccine will be available. I think May or mid-May is a good. I would say that it's a good estimate, but really we want to make sure that they have all the data that they need in order so that we know the appropriate series, or I guess the amount of vaccine shots that you'd have to get. So if it's a 2-dose versus a 3-dose, and it's just it's clear that there weren't safety issues, but we just wanted to make sure that when this vaccine comes out, it does provide that protection for the younger children.
Perfect, thank you. And then for our children who are 12 and older, our adolescent group, and adults, we know that the CDC has recommended a booster dose to be received 5 months after their second dose of the Pfizer vaccine for 12 plus. What about the newer recommendations for another booster for people over 50? We have a great question from Tony D'Agostino. Thank you so much for participating with us tonight, Tony. He wants to know the guidance regarding the second booster for those over 50. So break that down for us, Dr. Mushonga.
Yes, well, recently we just received the approval from FDA and CDC that for individuals that are 50 years and older and are 4 months out from receiving their last booster dose, they're eligible to receive a second booster dose. Also, individuals that are immune compromised fall into that category of also receiving a second booster dose. What I think is important is that we know the data, and we've been looking at just the efficacy of the vaccine, and we do get a bit of sort of waning of that. So it does lessen a little bit. And so getting your booster dose, if you're 50 and older or have any immune compromising conditions, would be best to give yourself the best protection. As you mentioned earlier in the opening, we are starting to see a bit of a rise in the BA2 subvariant of Omicron, but we still are monitoring what's happening in this pandemic and if there are other variants. So it's best to really stay up to date based off of your needs or your particular risk factors.
Perfect, thank you so much. We have a great question from Jessica Lewis. And I'll talk about this a little bit, and Dr. Mushonga, if you want to add anything. Jessica Lewis asks, why would we give our children this vaccine when the virus has little to no effect on them? So, I'm a pediatrician. I see children, every day who, are in school and, exposed to their, family members, siblings, classmates. And I'm a mom of 2 children who are also school age here in Wake County. And this is definitely a question I get asked when the majority of children who are exposed to or contract COVID typically do pretty well. They don't end up being very, very sick as far as being hospitalized or dying. Why do we still need to vaccinate them? And I think there's a couple of things to consider. One, children spread disease to other children, other adults, family members, grandparents. And so helping to get people vaccinated helps to protect communities and families, not just the child. But, it would be a mistake to think that children can't get sick. As a pediatrician working in this pandemic for the past oh, it's been more than 2 years. We have seen some children get very sick, some get hospitalized, some need respiratory support like a ventilator, and even worse, I mean, we've seen children die in Wake County from COVID. And so you never know what the case is going to be for your child or their classmate, their immunocompromised classmate potentially. You never know what their case is going to be like. And then the other thing is I am starting to see more and more cases of long COVID in children. And like adults, we know that, maybe up to a third of people who have a case of COVID, even if it were a very mild case or a case that was asymptomatic, you didn't even know at the time that you had COVID, we're seeing that you can have some long COVID symptoms that can last months and months. I've taken care of children who are experiencing such debilitating fatigue after a mild case of COVID that they can barely attend school. I've taken care of children who have developed neurological symptoms like tics and other disorders after COVID. Children who have long-term respiratory symptoms leading to them not being able to play or return to, soccer and doing the things that they want to do. So it would be a mistake to think that one, kids don't get sick, two, that people around them don't get sick, and three, that there's not going to be long-term consequences, even from a very mild case of COVID that didn't make them very sick during the active infection. So that's why I think it is still really important to get children not just vaccinated with the 2-dose series, but get their booster when it's time. My adolescent just received his booster dose this week. It was a little delayed, Nicole, because he actually had COVID back in January. We had, thank goodness, our family contracted COVID. We were all vaccinated and boosted as we were eligible, and we all had really mild cases and did really well throughout it. So we were very, very thankful for that. But it's just another reminder that it's not time to drop our guard. We need to keep getting vaccinated and boosted to make sure that we stay safe. Is there anything else you want to add to that, Dr. Mushonga, or even ask another question from Bielka? Thank you for asking and participating tonight. Should healthy teens who received their second dose of Moderna, should they get a booster? So anything to add about children's vaccines in general, and specifically, when do teens who got Moderna need a booster?
Yes, so right now, what we're looking at, Moderna is not currently available for individuals under 18. So I'm not sure about a teen that might have received Moderna, but if they have received Pfizer and they are 12 and up, then they are eligible. Once they have reached that 5-month mark, they should be eligible to receive their booster. As I have mentioned, the recommendation now and what we continue to say is stay up to date. You never know when you might come into contact with COVID. If it might be an asymptomatic case for you, or you might be around someone that's asymptomatic and spreads that, and then you contract it. But if you are up to date with your vaccines, time and time again, we've seen from the data that you are at a less risk of hospitalizations and death. And that's what's going to keep you safe and help protect your community. When people are eligible for their booster dose, that is when we recommend that they get it. We know that it provides protection and helps to keep our community safe. And as you mentioned, it can protect not only the person, but their household and their community, because this virus spreads so quickly, and you don't know potentially how it might affect either yourself or people that you live with, or if anyone in your household is maybe immune compromised and can have are at higher risk of contracting this virus and having a more severe case.
Perfect. Another booster question. This is about Moderna. So if someone is over 86, let's see, 86-year-old who received their third dose of Moderna, do they need another vaccine? Do they need a booster?
Yes, so those that are 50 and older are now recommended to receive a second booster. So if they receive their booster, 4 months later, they'll get a second booster.
Perfect. And so that's for Pfizer and Moderna, is that right?
Correct.
Perfect. Thank you so much. Okay, let's see. We've got some other good questions coming in from Facebook and YouTube, but I want to take it to the barbershop where we are live with Allison from El Centro at the main attraction barbershop. And Allison, do you have some questions from our community members?
Yes, we got one person right here.
Hey, Doc, how you doing?
I'm great. Thanks for participating. What's your question?
Yes, ma'am.
Introduce yourself and what's your question?
Hey, I'm Rob at the Main Attraction Barbershop and Salon and Tattoo Parlor. But the question is this going to become more like a flu thing, and where it's going to be an every year vaccine or every 6 months vaccine?
That's an excellent question. Thank you so much for being here and asking that great question. Dr. Mushonga, tell us what's the future of the COVID vaccine recommendations? Is this going to become like an annual flu vaccine where you're always required to get it in the fall, or what's going to happen?
So great question. We're still waiting to see what that looks like. We are seeing that maybe for certain populations, there might be a need for an annual booster or annual vaccine. For other populations, maybe younger, healthier, no chronic conditions or things that would put you at high risk. In that case, there might not be a requirement, but we don't know. Those were all potentials and mights because we just don't know yet. We have been studying the flu for many, many, many years and developing our vaccines and have gone through this process for a while now. And with COVID, it's amazing to as we say this, but we were just starting this journey and getting our population vaccinated just a little bit over a year ago. So this is a very, we are still learning and trying to understand how it's going to really affect our population and what will be the needs and how long does that protection last once you receive that vaccine. So more to come, I can say, just more to come.
Thank you, Dr. Mushonga. And Rob, I hope that answered your question. And keep following us here on Ask the Doc Town Hall. We'll keep you up to date, Rob. We'll keep you straight. There's an interesting question from...
Oh, yeah. We have someone else here that would like to ask a question.
Yes, more from the barber shop. I love it. Live from the main attraction. Introduce yourself and ask me your question.
Hello, my name is Tweet. I'm a stylist here at the Main Attraction. And my question is, I had COVID back in August of last year. I still have not regained 100% taste and smell. I've been told to try citrus stuff, and I've been told to try minty stuff, but nothing. Sometimes it's hard for me to eat certain things because what I smell, I eat it. Like my food tastes like what I smell like, what's smelling in my nose. And sometimes it's hard to try to keep a healthy diet like that because you're trying to get over that taste and you're trying to get over that smell. So I would like to know, is there any type of like remedy or some type of something that you could do to kind of help regain the smell? Because in August, it'll be a year that I haven't had it. And it's, my nerve.
Yeah, gosh, Tweet, thank you so much for asking that question. And I'm so sorry that, you're still having that side effect, that long COVID kind of symptom of paranosmia, or, you know, abnormal taste and smell after having COVID. We hear that a lot. And, you know, for some people it's lasted longer than others. Dr. Mushonga, can you help tweet out? Is there anything that you can recommend? I mean, I've heard about like nasal steroids, maybe like Flonase. I'm not sure. Tell me, what do you know about that?
Yes. So I think that the challenge is that there's not one specific thing that's going to magically sort of bring it back. And Tweet, I understand, because in January of 2021, I had COVID and I lost my taste of smell, excuse me, my taste and my smell. And it has taken me, and I still don't taste things exactly as I used to over, I think, what is that, a year and maybe 3 months ago? It's come back in pieces. It's come back in parts. So I know I don't want to scare you. I see your face, but for some people, it might take longer. I've had conversations with others where they've regained their smell and their taste within about 6 months or so. And for some people, it's just taken a bit more time. And I happen to be one of those. Hopefully that's not the case for you. But it's definitely something that that can take time. So don't feel bad if it's not here yet. But still, it's I know that's frustrating as you're trying to enjoy your foods and things, and it's just not quite there. And for some people, it might be a little bit different. And yeah.
Yeah, I my children had it, and it just seems like it never fazed them. But I'm the only one that's still suffering, and it's just hard sometimes when you want to really enjoy the food that you're eating and you can't, because sometimes I feel like I taste and smell the true smells of stuff. Like when I walk in places and I'm like, what is that smell? You know, it's like I feel like I'm smelling what we're supposed to smell, because we've been on this earth for so long. It's almost like when people live in their house, you know, they're used to how their house smells, but a new person can come in the house and smell something different, you know, and it's like, you know, so that's, sometimes I'm trying to take it like that and just say, you know, okay, just be glad with the 85% that you have. But just know that other 15% of me regaining that back is so hard, because I can't really. And then it also scares me too, because I was reading about how people that are in the house and they don't know about fires that may happen because they can't smell the smoke or the carbon monoxide and stuff like that. Like that stuff really, you know, this is something else. I've never really thought that I would have to deal with this, but it's so long, like it's so long, but I still got the hope that it's gonna, you know, come back. It's just, I hurry up.
Yeah, you know, I will say, I have had several, you know, colleagues and acquaintances that have had similar things that have lasted. People who were thinking, my gosh, this is ever going to come back. And many of them have said, like, slowly and slowly it did, and it's gotten better and better. And sometimes it happens so gradually that you barely recognize that indeed it is improving. But, you know, your nerves are like regenerating and growing and making those connections anew. And that's a slow process. But I've seen people talk about, you know, kind of smelling strong scents and practicing, you know, things that should be strong scents, like a spice like oregano, or a very bright citrus smell, and getting a deep inhale of that, and then sitting with it and kind of letting your brain process it, and almost like doing that as an exercise a couple of times a day, to kind of relearn and retrain, and as those nerve cells are kind of regrowing, that exercise that can help. But you know, I think, Nicole, I wonder if, you know, if things aren't getting better and she continues to have this, you know, I wonder an ENT potentially could be someone, an ear, nose, and throat doctor that you could see and see if they have any more advice and suggestions. But again, thank you so much, Tweet, for being a part of our live at the barbershop edition. That was a great question.
Oh yes, thank you.
Yeah. All right. I wanted to say thank you again for a main attraction, barbershop, opening the door to El Centro, Allison, Julian, to, give their, coworkers and community members the opportunity to ask questions and get the facts. So awesome, awesome job. Thank you so much. Okay, I have another question from Benjamin Moore. Benjamin says tonight, I'm ashamed to say that members of my family are still not vaccinated because they think the virus is lessening and it's not worth the risk. Any advice on convincing them that they should still get vaccinated? Ooh, that is a tough question, Benjamin, because we're in a position where the people who were eager to get vaccinated and the people who were easily convinced they've been vaccinated. And we're really in that group of people who are a little more wary and reluctant and need more conversations. I will say, as someone who has these conversations on a day-to-day basis with families and children and offer vaccines to adults and children in our clinic, I think patience and listening are two really important skills. Sometimes we want to bombard people with our evidence and facts, and sometimes people really just want to be heard, not judged or shamed, and given the opportunity to come to a decision. I also have seen people who, people close to them and around them, they've seen them get vaccinated and do well and have minimal side effects, and that helps to allay the fears about getting vaccinated. We can sit there and tell them all day that we've vaccinated millions and millions of people and have seen so much data on how safe and effective the vaccines are. The side effects that someone might experience that are common are pain or swelling at the site of the injection, a fever, feeling achy or tired, even a headache. Those are common things that can happen after the first or second or any dose, are usually short-lived and happen in about half of the people get vaccinated, and even less it seems in children, just from my personal experience. But sometimes it really still just takes patience and not giving up on them. I'm surprised, Dr. Mushonga, at the number of people who I approach about this for the multiple time that I see them, and this time they say, yeah, I'm ready to get vaccinated. So don't give up, right?
I agree. I think what we're seeing even in our vaccine clinics, we still have people coming to get their first dose, adults, so people that have been eligible for over a year now. And for some people, it just takes a bit of time. They need to maybe see more data, feel more comfortable. And you mentioned a very great thing, listen to them, because we have the data, we have the stats, we have the stories, and we know all of these facts, but for them, it's listening and understanding where they're coming from. And, I think not giving up and always kind of sharing, when you're ready, there's an opportunity, and, this will protect you, protect your community. And we've made it very easy now for individuals to go to any location across our county and even come to them in different events to offer vaccine. So.
All right, we've got two really good questions coming up. All right, so the first one is from Maria Lopez. And this is going to go to you, Dr. Mushonga. Maria Lopez says, I have COVID-19 now, and my work says if I have no fever, I can come back to work after 5 days. She's worried, can she still pass it to others in the job? So can you remind us what the guidelines for when people can come out of isolation after having COVID? Give us the guidelines on that, Dr. Mushonga.
Absolutely. So for someone that tests positive for COVID, they need to isolate it for the first 5 days, at least for the first 5 days. If they don't have a fever and their symptoms are improving, then on day 6, they can come out of isolation, but they need to wear a mask and be very, very cautious about when they are without their mask. And that should be limited. And ideally, they are not around other people when they have to take their mask off to maybe eat or drink. But it's important that for someone who has had COVID, if they don't have a fever, their symptoms are improving, on day 6, after their symptoms have started or if they've tested positive, day 6, you can leave isolation, but continue to wear a mask through day 10. And so at that point in time, after day 10, you would be free to not wear a mask if you chose, or if you're still symptomatic and are still not feeling good. There's no, there's no push or no rush for you to feel like you can't continue to wear your mask and continue to, continue to give a safe distance from other people.
Great, that's really helpful. The couple of things that I like to remind people: one, the day that you start having symptoms or test positive is day 0, not day 1. So you count day 1 after that day 0. And then wearing a high quality mask, not just a cloth face mask, not even just a surgical mask, but if you have access to a KN95 or N95 mask, then that would be the highest quality mask that can help protect others. And I encourage people, especially the weather is getting so lovely, if you have to take your mask off for a break or to eat or drink, try to do that outside if you can, if you're returning to the workplace on day 6 or prior to day 10, I should say. So, okay, perfect. Thank you. That question from Maria Lopez was a great question. This is a great question. And I've got Dr. Michele Benoit-Wilson, OBGYN, women's health expert, on the line. She's answering questions in the chat on Facebook and YouTube. And I may bring her in on this question. So this is a great question from Gina Lopez. Gina writes, I was told my child's low birth weight is due to me having COVID-19 when I was pregnant. Is it possible I gave my unborn baby COVID-19? Should I be concerned for effects later for him? And I was vaccinated. So that is an excellent question. I'll start by saying, Gina, thank you for that question. And I'm so glad that you did get vaccinated. Because you help to protect yourself from not getting sicker and having a worse outcome, and you help protect your child. Your child got some protection from you being vaccinated also. So congratulations for doing that. And so Dr. Benoit-Wilson, do you want to talk about that for us? Is it possible that she passed COVID onto her baby while pregnant? And should she be concerned about her low birth weight baby and effects later for him? And then as a pediatrician, I'll also help to answer that question. But I'll let you start, Dr. Benoit-Wilson.
Hi, thank you, Dr. Monroe. And that is a fabulous question that you asked, Gina. And I apologize to everyone for being off camera. I'm just trying to answer some questions in the chat as they come up. But first of all, Gina, again, you did a fabulous job and you did your part by getting yourself vaccinated either before you got pregnant or during your pregnancy. That was the 100% right thing to do. And just to echo what Dr. Monroe said, you gave yourself as much protection as you could, and you also gave that protection to your baby. So congratulations for doing that. It's not really possible for us to know while you're carrying your baby if your baby potentially was definitely exposed to the effects of COVID, but we do know that pregnancy in and of itself is a separate risk factor for getting more severe effects of COVID if you were to get pregnant. If you were to get COVID while you're pregnant. And one of the potential effects of COVID in pregnancy is a low birth weight baby. Now, having said that, there are lots of different reasons that someone can have a low birth weight baby. So, no one would be able to tell you if it was definitely because you had COVID when you were pregnant. But it is routine for us to take a closer look at the baby during your pregnancy if you've had COVID, because we know that that's one of the risk factors. But again, the vast majority of women who have smaller babies, those babies do really well. Not all of us have the same size babies, so there's a big variation anyway, outside of COVID. But you did the absolute right thing by getting vaccinated during your pregnancy, and you were able to give your baby the best possible chance of doing really well during your pregnancy, despite getting COVID.
Thank you, Dr. Benoit-Wilson. That's a really good point. I like the last point you made. She did everything. She did her job. She gave her baby the very best chance of doing well despite getting COVID. And as a pediatrician, I'll just say that, it will, I work with babies who were born preterm or low birth weight every day. And we work very closely with the families to ensure, that we optimize their nutrition and help them to grow in a healthy way, and continue to follow them closely for, development issues, and support them however we can. But that many of these babies just grow and flourish and do well. And, obviously you'll keep following with your pediatrician very closely with your baby. But we definitely wish you the very best. And we've seen many moms who did get COVID during pregnancy whose babies, did well, especially if they were vaccinated. So we definitely wish the very best for you. And thank you so much for asking that question. All right, we've got more questions coming up. So I like this question because we're all getting ready to travel, aren't we? We've got spring break coming up and holidays and summer. And this question comes from Louisa. She says, I'm preparing to travel soon and don't know if I should wear my mask on the trip. She's worried. Am I going to look weird? How do I know when or where to mask if it's no longer required? Dr. Mushonga, what would be your recommendation? So first, I'm going to say we're traveling in a couple of days, and I know for sure we are wearing our masks in the airport and on the airplane. One, because they're still required. Two, because that is a very tight, close contact situation. We will not be able to socially distance. So we will definitely still be wearing our masks. But how do people know when or where to mask and they don't want to look weird? What do they do, Dr. Mushonga?
Yes, so we are just returning from spring break travel, and where we took a plane out of the country, and we all had our KN95 mask on while we were in the airport, while we were in the plane, and even while we were getting settled and checking into our hotel. And as we were able to be out and a bit more within, like, outdoors, we had our mask off. And even now we know that the cases of COVID-19 are really low, which is great. And so there's less of a risk in knowing our status, as far as we've gotten gotten our 2 doses, we've gotten our boosters, the kids are vaccinated, those things that really give us protection. We've tried to maximize the things that we could do to protect ourselves, and that's the recommendation. Make sure that you're, and when I say up to date, I mean that if you're eligible for a booster, that you've received it. Just staying up to date with your vaccine series and knowing your risk, because for some people, they might have underlying conditions where contracting COVID could be more serious for them. And so it would be important that they would probably still wear their mask in unknown settings. or in settings where they were around lots of people or not knowing what their status was. So it's turned more into understanding what are your risk factors and how can you best protect yourself throughout this pandemic. And so you can always feel, I always tell people, don't worry about feeling as if you can't wear your mask. You always can wear your mask. But just understanding what risk factors there might be, and maybe knowing where you're going too, because while cases might be low here in North Carolina, and if you're going to Europe or going somewhere else, you know that we're seeing increased risk of cases. And so that might be a place that you would want to wear your mask more often.
Really good points. Thank you so much. I think for us, for my family, we are healthy and young. I consider myself, Nicole, am I still young? Dr. Mushonga, young and healthy and vaccinated and boosted as appropriate. And we are feeling good about the very low case rate, incidence rate of COVID in our community. So we feel good about airplane travel with masks, going and doing a lot of outdoor adventures and some indoor adventures. Personally, our family has chosen that we won't do indoor dining just because that's one of the higher risk things that you can do, and because the weather is so beautiful and it's really easy at this point to choose outdoor dining on our vacation. So those are some of the things that we've chosen for us, and I'll never worry about looking weird in my mask. All right, I have another question from Lydia Martinez, who says, is it true that the reason they have removed the mask mandate in schools is because children were suffering from not breathing properly when they wore it? You know, you hear all sorts of different things, and it's hard to know what's true and what's false. So Dr. Mushonga, do you want to talk about that? Was there any risk to children not being able to ventilate properly or to breathe sufficiently with masks on? And why did the mask mandate get dropped in schools?
Yeah, so the mask mandate was dropped because what we were seeing is that we had a lower incidence of cases. We had a larger population that was eligible to receive vaccine, particularly from those that are 5 and up. And so we had really good data around individuals, around particularly kids, and we were in a different phase. And so there was either immunity from vaccination or immunity from prior infection. We were also seeing that we had less severe illness associated with the particular variant at the time. And so there were a combination of factors that went into making that decision. And as you mentioned, the lower incidence rates that we're seeing within our communities. And I say that because they all are, it's not one thing that leads to making these changes in policies and recommendations. It's a multitude of things that when put together, we can see that there's a lower risk for our community.
Thank you so much. And, you know, we'll continue, and, you know, our local leaders will continue to follow the science and look at the changing evidence. And I'm really appreciative of that, right? That there's not one blanket yes or no, it's time to mask in school or not, but we look at all the factors and make the best decision. So I appreciate that. Okay, this question I'll answer. Thank you so much, Laura Jaramillo, for asking this question and being with us tonight. Laura says, my son has been super sick for 2 weeks and he's 3 years old. Should I have him tested, or should we just isolate until he's better, since toddlers are always going through something? And as a mom and a pediatrician, yes, aren't they always going through something? Toddlers, for sure. You know, generally, the way that you describe he's super sick and it's been 2 weeks, I would recommend that you go in to see your pediatrician. That would be my recommendation. If you called me and were a patient in my practice, I would want to see him because it's been a while and you describe him as super sick. He may need to get tested for COVID or any other thing like flu, or to see if he has some other thing going on, like pneumonia or anything else that's making him super sick and for 2 weeks. It's true that a common cold will last you, 10 to 14 days and then should start getting better. If this were COVID, he really has already gone through his isolation period, really, if it's been 2 weeks. But it's not the COVID testing even specifically that makes me say you need to see your pediatrician, but the fact that it's been that long, he's 3 years old, and you describe him as super sick. So do call your pediatrician or family doctor, whoever your child sees, and where he gets his vaccines and checkups, and have them take a look at him is what I would recommend. Okay, this question is for you, Dr. Mushonga, from Paul Jones. And this is an excellent question, Paul. I appreciate you asking it. Paul says, I am not vaccinated because I was told that my multiple medical conditions would be compromised by the vaccine. This has cut down on my quality of life dramatically. So, Dr. Mushonga, I would love for you to speak to that. Are there medical conditions that would cause us to say you should not get vaccinated? And how would you advise Paul? It's been 2 years in this pandemic. I'm inferring from this that, he maybe has not kind of been able to go out and see friends or be out in society because he's worried about getting COVID, because he's not vaccinated. And he says, this has cut my quality of life down drastically. So Dr. Mushonga, how would you respond to that, and how would you advise him?
Absolutely. So the first thing I would say is that it would be great to have that conversation with a primary care doctor, if he has one, because I think you could really have the conversation about one, that doctor, your physician, will know your history, your medical history, and if there are any contraindications for you, particularly to get the vaccine. We know that the vaccine has been shown to be safe, and there are very, very limited circumstances under which individuals are not eligible or should not receive the vaccine. But those conversations really have to happen between you and your medical provider, with them knowing your history, for which you would be trying to receive the vaccine. And it's just having an honest conversation about what that looks like and how it's impacting your life currently, and what other options there might be for you.
Thank you so much. I'll take this next question from Nicole Rush. Nicole writes, it's summer camp season soon. Any thoughts on sending your child to camp, to day camp, or even overnight camp? And that's a great question, Nicole. Again, my boys have we were pretty hunkered down during COVID until we got vaccinated. And so we were really sad to miss all summer camps and sleepover camps last summer before they were vaccinated, and are very excited to return this year. So we made the decision as a family. It's going to be an individual decision based on your personal comfort and also risk factors. And my 2 children who are healthy, both vaccinated. The one who's eligible is boosted. With the incident, the cases being so low, we felt comfortable with them going back to summer camps and even overnight camps this coming up summer. So we're very excited. They are very excited about that. They're going with other friends who are also vaccinated. And we're excited that the camps that we've chosen have some safety protocols and measures that we trust will help to keep everyone safe and screen people, prior to arrival. So what about you, Dr. Mushonga? How are you feeling about summer camp season?
Yes, my son, he is excited to go to summer camp, and we are actually planning for him to attend. He is vaccinated. He's not eligible for a booster yet, but when it is his time, he definitely will receive that. It's one of the things that I think is important for him is he gets to have a bit of normalcy and being able to go back and interact with other kids and have a great time over the summer. And as you mentioned, just knowing what the risk factors are for our family. You know, we're all pretty healthy and young and are up to date with our vaccines. And so we don't have as larger of a concern that he would potentially bring something back, or it would be more severe or detrimental to individuals in our home. However, we continue to monitor things and continue to watch and monitor cases and case rates. So, but it is, I know a lot of parents are making those decisions now, and case rates are down, vaccinations are up, and we're in a better place than we were a while ago.
Great. Awesome. Looking forward to the summer for both of our families, everyone's family. We're going to go back to the barbershop salon. Before we do, we are going to come back to a question about how effective N95s are, and if they are indeed effective enough to stop the spread of COVID based on the size of the virus particle and what the N95 is able to filter out. So Dr. Mushonga, I want you to put a pin on that. Paul Ferry, I see your question. I'm not going to forget you, but while we've got people in person live at the barbershop and salon, I am going to take us back to Allison Perez, who is live and in person with community members at the main attraction barbershop and salon. Allison, who do you have with you and what's the question?
Okay, I'll let him introduce himself.
Hello, my name is Alexander, and I'm with a main attraction. I'm a tattoo artist. And my question is, hold on, let me get it. I'm kind of nervous right now. Let me get it back. Okay, with the, hold on 1 second. Let me get it. Let me make sure I get this right. It was right on top of my head. What did I just say? I wanted to ask.
What are the different?
Okay, what is the difference between flu and COVID?
Thank you so much for that question. I appreciate you being here tonight. I appreciate you sticking in there and remembering that question, because that's a great question. So Dr. Mushonga, we know that, the flu and COVID can have similar symptoms, can make you achy and cough and fatigue and sore throat and fever and all these things. So since the symptoms can be similar and we're seeing both flu and COVID in the community, what is the difference between flu and COVID? How do we tell the difference, and why does it matter?
Yeah, so one of the things, they're both viruses. And so what's nice, or at least one of the things that we can do, is we can test for them. We can test for COVID, we can test for the flu. And what happens is that with that information, we can then use some of our oral agents, so oral medications, to help treat those that might have the flu. If you test positive for the flu, you can have an oral treatment that helps reduce the symptoms and severity of the flu. But we also have that available for COVID now as well. And so there's oral options that you can take that will help to either reduce the length and reduce the severity of having COVID-19. So one of the things that we always said that stood out early on in our early on in the pandemic is that the difference is that a lot of people were losing their taste and losing their smell. And that was one of the sort of signifying factors for COVID versus flu. Not that it can't happen with flu,
Right.
that can happen with any viral illness, but we were seeing it more with COVID.
Okay. One more question. Does supplement pills help fight COVID?
That's a great question. So you're wondering, is there something that you can take supplement-wise to help prevent catching?
Help prevent. Right.
Yeah, that's a great question. Dr. Mushonga, how would you answer that?
So we don't have anything, well, I take that back. We do have oral agents that can potentially help lessen and reduce the severity of that, but supplements, meaning sort of like vitamins and things along those lines, I don't have any very specific evidence that points to that, but we know that if you're able to maintain yourself in good health and balance, that you would be able to be better equipped to fight off the virus had you come into contact with it.
Okay. Okay. Thank you. Thank you very much. You were very helpful.
Awesome. Thank you so much for your great question. As we're thinking about staying healthy and taking supplements, keeping in mind that, getting enough sleep and, eating healthy and refraining from smoking, all sorts of things like that generally are just good advice to maintain good health. I want to go back to the question that we were about to pose, Dr. Mushonga, from Paul Ferry, who writes, don't wear the mask. It doesn't protect against a virus smaller than even what the N95 is rated for. And especially in close quarters where the virus may be concentrated. And, I appreciate that question, Paul, because there's certainly information kind of circulating out there that makes this very confusing for people. Like, if the particle size of of a COVID particle is, let's say, 0.1 microns, which is eensy, wincy, teensy, weensy. And the N95 mask can filter down to 0.3 microns, right? That seems like a virus particle could get in one of the holes of the mask. If you think of the mask almost like a tightly woven mesh, it seems like a particle could pass through. But we know that these virus particles don't exist alone. They exist in droplets of spit and sneezes and saliva. And when they exist in those droplets like they always do, they are more likely contained in a glob of something that's about a micron large, which is easily not 0.1 like the viral particle itself, not 0.3 like the filtration of N95, but a micron, which is easily filtered by an N95 mask. Additionally, there's other safety measures or barriers in the N95 and surgical masks that work besides that protective netting. The electrostatic force that helps to attract things on the outside of the mask so that they don't pass through. So I know it can be really confusing because you see this information out there and people are like, it doesn't even work, it doesn't even help. But Dr. Mushonga, what evidence have we seen that supports that masking works and that N95s are very effective and high quality at preventing the spread of COVID?
Yes, so there have been studies done that have shown just that when individuals who are wearing a mask and come into contact with someone else that has tested positive, and if that person is also wearing a mask, they are less likely to be able to contract or even to spread the virus. So the mask not only protects you, it protects other people. And one of the biggest things with the N95 mask is ensuring that you have the best fit. You want a good fit and a good seal around your nose, around your mouth. And, that provides the best protection there. Nothing is 100%. I think we say that and we know that we're doing everything that we can to protect ourselves, and wearing an N95 mask or even a KN95 mask with a really good seal, as they should have, that will protect you and provide you better protection. But that's in combination with being vaccinated and just understanding that you're doing everything that you can to protect yourself and protect the community.
Thank you so much, Dr. Mushonga. And it's true, there have been so many studies done that show that, universal masking absolutely reduces the spread of COVID, even before Omicron, and the more highly contagious, subvariant. We saw that evidence. We saw that in schools, that in districts where universal masking was, there was a universal mask mandate, there was significantly less, spread of COVID throughout schools, and days missed for students and teachers because of COVID. So let's see. Let's see, a couple of questions coming in. They're coming in so fast, I'm having a hard time keeping track. Let's go back to this question from Kate Rincon. Kate says, I totally get the earlier question. I was told by my doctor that I'm allergic to components of the COVID-19 vaccine, and now my job is requiring I go in person. What do I say to my job, and what accommodations should I request? Dr. Mushonga, what would you advise Kate, who's been told that she's allergic to components of the vaccine and it's required for her work? What can she request?
Yes. So if she is allergic to certain components in the vaccine, then she should once again have that conversation with her physician. But then also, if there is an allergy there, or a medical condition that would not allow her to get that vaccine, she can provide that documentation, and should be able to provide that documentation to her employer. And that way, that she would be able to share that information with them. Things that she can do to protect herself since she is not vaccinated is continuing to wear a mask when she's there, and she's maybe in meetings or in other settings where she's around lots of other people, and just maintaining her distance, continuing to wash her hands frequently. And so just remembering all of those things that we still continue to do, but just being more vigilant about it, because knowing that her not having that vaccine, she might be a bit more susceptible to the virus.
Thank you so much, Dr. Mushonga. There was a good question from Raquel Pignol, who says, my 12-year-old son hates needles. What do you recommend I do to get him vaccinated? And Raquel, I feel you in my spirit, because I also have my older son who really, really, really does not care for shots. And so I understand that that can be a challenging situation to get them vaccinated. I'll tell you personally what I think as a mom and pediatrician. So there's certain things that I do for my children that they're not big fans of, but they're non-negotiable. Including all the childhood vaccines that they needed to enter kindergarten and to keep them safe and to protect them from whooping cough and meningitis and pneumonia, and going to school every day. And sometimes they're like, we want to play and stay at home. Or even when they were younger and they tried to refuse to wear their seatbelts or bike helmets. These were all things that were non-negotiable. And, we did the best we could to make it not such a fight or so painful, but it was something that needed to happen. So just like my older son, when it was time for him to get his required vaccines in middle school, I told him, this is what we've got to do to stay safe and keep you protected, and this is what we're going to do. I personally don't give them a big heads up. I don't believe in stoking the anxiety and fear well before we're at the doctor's office. It just gets everything in a tizzy and gets them more and more anxious and nervous. But when we are at the location and seconds to minutes away from getting the vaccine, I will just give them a very comforting and reassuring, but decisive statement about what needs to happen and what we're going to do today. That works well for my older son. He doesn't want to know in advance. He can wrap his mind around it when there's barely any time to think about it, and he can get that vaccine done. And that works for him. I will say that, even in our most resistant children, as pediatricians, we are really used to vaccinating and doing sometimes uncomfortable procedures on children who are not cooperative or interested. And so, I would have the conversation with your pediatrician, depending on how high his anxiety and fear was about getting vaccinated, about any advice and techniques. But this is just something that we do, 50 times a day as pediatricians to get people vaccinated. And so, I always say it's my job as a mom to keep you safe, not necessarily to make you happy and to be your friend, but to keep you safe. And sometimes I make decisions that everyone's not a fan of. But Nicole, you might be nicer than me, Dr. Mushonga. How would you recommend that Mrs. Pignol can work with her 12-year-old son who hates needles and she wants to get him vaccinated? What would you recommend?
Oh, I think we're kind of on the same wavelength there. But I do say, I know and I think one kind of knowing a bit of what your child needs, because even though they might be afraid and scared, sometimes talking it through with them might help. My son was afraid to get, he's afraid, he didn't want to get a shot. He's like, I don't want to get a shot, but he wanted to. For him, we had been talking about this providing him protection and being able to do things, and just we really framed the conversation about, one, not necessarily the shot, but what happens once he has that protection. And so he understood that, and he knew that, I have to get this shot as a part of this sort of protection that I'll have. But we were able to have a discussion, and even at such a young age, just talk about it and what does it mean. And he understood that. And one of the things I did was I took him to an event that we had scheduled for kids' vaccinations, where there were lots of fun kids things around. So we went to an event at the Post Center here, and he was able to see other kids getting their vaccine, see really cool science facts and things. So it really kind of took his mind away from the fact that he was getting the shot. And once he got it, he goes, oh, that wasn't so bad. And that's usually, what happens after they realize it's very quick. But I think Dr. Monroe has given some really great advice about talking with a pediatrician, and then knowing that if telling your child beforehand that is going to cause a lot of anxiety, a lot of fear, probably waiting. So, yes.
Thank you, Dr. Mushonga. And, the other thing for my children, it helped them be more eager is, for us, we hadn't returned to, in-person events and sporting things, last year before they'd gotten vaccinated, or sleepovers. And so for them, it was like, yeah, let's do this because this helps them return to normal. We've got a lot of good questions in the chat. So let's see if we can get through a few of these. This is a great one from Maria Jose Pena. She says, I missed my second dose listening to foolishness. Do I need to start over? It's been over a year. Dr. Mushonga, how would you suggest that Maria proceeds to make sure that she has got protection?
Yeah, so, it's important that she'll go back for her second dose, and to be honest, I'll have to take a look at that, because I'm not sure that I've seen as long as a year. But I think once you go back, you get that second dose, just staying on top of that schedule of when you would get your either your next dose or a booster dose. That way that you kind of stay, as I keep saying, staying up to date on your vaccines.
Yeah, I hadn't seen as long as a year either. We were typically we would say you don't restart the series, right? Like you get the second dose, and but I also hadn't seen as long as a year, so we might need to do some research on that. I'm going to send a last call for questions at the live from the barbershop event with El Centro Hispano and Allison and Julian. If there's anyone else who has any questions there, please go ahead and line them up for me while we answer this next question from Queen Anderson. Queen says, if testing is free, why are some places asking for insurance? Because could this be a scam? So while testing is free to the patient, to the consumer, it is covered by your health insurance. And so in order to get reimbursed, some places, depending where you're getting testing, may be asking for your insurance. Other places aren't submitting to insurance, and they're not asking for your insurance. So, if it's a reputable place that has probably an online presence and marketing, it's a local drugstore or a Wake County site, Wake County DHHS site, or a physician's office, then that doesn't sound like a scam. It sounds like probably they're just trying to get reimbursed for that, even though it's no cost to you. It's still, there is a fee for the personal protective equipment and the nurse or MA or doctor who did the test. And so that's probably why. I like this next question from Alexandra Buenaventura, who says, when I visit my family, my sister yells at me about wearing a mask. She makes me feel dumb for trying to be safe. What can I say to her? Ooh, that's a tough one. Dr. Mushonga, what do you say to her sister who is yelling at her and making her feel dumb for trying to be safe?
Yeah, so I've always shared with people, you should never feel uncomfortable wearing a mask. If you are more comfortable wearing your mask, then you wear it. And if you have to go into settings and you feel that you're being either ridiculed or being yelled at, maybe those are settings that you probably shouldn't go to at this time, or just explain to them, have a conversation with them and say, this is what I feel comfortable doing. And I feel comfortable being in my mask. And this is what I choose to do. And just as someone else would choose not to wear a mask, that is the choice that they have made. And your choice is to wear a mask. And you might have good reasons for that. And if it's maybe you're just, you feel more comfortable with it. Maybe there's other risk factors, and no one has to know that. This is your ability to wear a mask is that your decision.
Yeah, thank you. And I also remind people, I'm wearing a mask to also help protect you. So you're welcome. All right, let's see. We are getting close to the end and we are wrapping up. I think we have one last question. And I love this question from 7-year-old Bella Pena, who asks, when I get vaccinated, will I get sick like my abuela? So her grandma, her abuela, what should 7-year-old Bella Pena expect, Dr. Mushonga, after getting vaccinated? We did talk about earlier that people should, may expect that they may have symptoms like headache, fatigue, fever, injection site swelling or pain, and that may be that that's what she witnessed with her abuela, which usually lasts for 24 to 48 hours is pretty typical if you have it at all. I will say that after my first dose, I had really minimal symptoms, and after my second dose, I had less. I think a headache and a sore arm were probably my two biggest symptoms. But what should 7-year-old Bella Pena expect when she gets vaccinated?
So that's similar for children as in adults. There's always that possibility that you can experience that fatigue or headache. But as you mentioned, usually within 24 to 48 hours, those things go away. There's ability to take over-the-counter medications to help ease some of those pains if it does become sort of uncomfortable for you. But it does not last long. And so that's one of the takeaways, is that it could be there for a day or two, or it could not. Some kids and some people don't have any side effects after receiving the vaccine. So it really just depends. Every person is different.
Thank you so much for that question, Bella, and that answer, Dr. Mushonga. Bella, I hope you feel excited to get vaccinated and that you can head down and know that things will probably be great for you. Okay, so it doesn't look like we have any more questions. I do want to say thank you so much for our partners at El Centro Hispano, at the main attraction, barbershop, salon, and tattoo parlor. I keep forgetting the tattoo parlor. We really appreciate you guys, Allison, Julian, and all the community members who asked some fantastic questions tonight. I love this new live from the barbershop edition. So thank you so much. We're going to wrap up with a couple of reminders. So the recording of this Ask the Doc Town Hall will be available immediately following the broadcast on WakeGov, Facebook, and YouTube. Remember to check the chat for the helpful links. Get up to date on your vaccines at wakegov.com/vaccine or wakegov.com/vacuna. And thank you again for your great questions. Thank you so much for joining us, Dr. Nicole Mushonga, Dr. Michele Benoit-Wilson, Wake County Public Health. Thank you all so much. And